I do this thing. You may notice. I can find it difficult to hear my own voice. And sometimes I can't. I have to go slow. I have to pause to hear myself. I remember being 8, the age my daughter is now, trying to hear my own voice, not knowing I could go slow. I frantically searched for a voice, any voice, maybe a nice voice, a polite voice, a socially pleasing voice to fill the space. It was uncomfortable. It was like wearing clothes that don't fit or listening to music that you don't really like. At 16, this socially pleasing voice became more uncomfortable. So I put in the time, I deep dove alone to find my voice. It got messy. The deeper I went, the messier it became, in fact. It was hard to contain the messiness. It became oozy and expressed itself in a whole number of unpleasant ways, really. But have no fear. I found something that would have helped. Would have helped me at 8, at 16, and is helping me now. We have all had the experience as children of feeling unheard or trying to find our own voice. I believe I found an approach that changes the way talk happens so that children can talk for themselves more often. We have increasing statistics that suggest that children and young people feel unheard, particularly at times of their distress. And we, as adults, assume that children need us to speak for them, to have their needs articulated for an adult world. We're so well rehearsed at this, in fact, that we will utter, "You're okay," to a child that clearly isn't. What if instead of seeking further expertise and knowledge about our children, we place children at the centre of the talk that happens in their lives as a systemic response of our institutions, centralise our children's voices? Yes, I speak of our schools. Children spend their most formative years at school, and a complex ecosystem exists. An ecosystem about learning about being in relationship with one another, about being human. Yes, this ecosystem is pressured, burdened, resource poor, like ecosystems everywhere. But I'm not asking more from our schools. What I'm questioning is how can we stand steady with those working in our schools, the teachers and staff, in what they are already doing very naturally, in hearing and responding to children's voices. I've been a social worker for almost 20 years. And for the majority of that time, I've worked in child and youth mental health, many different services and organisations. And what I began to hear was an increasing medicalisation of the emotional experiences of children and young people. But when I visited schools, I heard something very different. I heard something special. I heard the tenderness of teachers' voices as they would offer their hand to a child to enter the classroom when it felt hard for them to say goodbye to their mum. I heard the tenderness of teachers' voices as they would walk beside a student who'd had their feelings hurt by another's words. I heard the worry and sadness in our teachers as they were impacted by the lives of our children. And yet, when something needed to be discussed about a child, boo, we would disappear. The adults would scatter to the far margins of the school, into little rooms behind closed doors, having meetings, talking amongst each other, sending off emails, making phone calls, leaving messages. I don't know what happened to the child. When something needed to be spoken about, the highly connected, relational process that I had witnessed was interrupted, made complicated, risk-averse, rule-bound. In seeking some sort of efficiency, it felt like all the best bits had been lost. Now, as you may be aware, teachers are being asked to develop further skills in responding to the wellbeing needs of students at a rate like never before, as a perceived solution to an ominous mental health crisis at the gates of our schools. Teachers are being asked to develop further expertise and knowledge more closely aligned with the mental health practitioners I'd been working with than a subject or classroom teacher. But what I'd witnessed was not that teachers needed to learn more, but to have the opportunity to share more, share with their own voice the deep knowing and understanding they have of the kids in their care. From the moment they arrive at school and they help them work out their lunches, to the moment they leave at the end of the day, they make sure they're on the right bus going home. Teachers know about our kids. They watch them go through some of the most significant developmental milestones they'll ever experience. I didn't feel teachers needed to learn more, but to have the opportunity to share more. So I started working as a school counsellor. I wondered if maybe this would help me understand better what was going on in schools. There is a great level of mysticism in the general population about therapy, right? Yes, well, this existed strongly in the walls of a school as well. I started on my first day and was welcomed with open arms, a little bit too excited. People were expecting me to do some sort of magic in my role with students. I'd like to demystify this for you a little. Come into the room of a school counsellor with me. I would sit in this room and meet with students. They wouldn't be that far away. They'd be a lot closer. We would sit and students would share with me their worries and their concerns, their fears, their sadness, their hopes and their dreams. But mostly, students would share with me the impact of the relationships around them on them, their relationships with their families, their relationships with their teachers and their peers. Now, I feel deeply honoured and privileged to hear a young person articulate the meaning they create from their experiences, using their own words. I feel privileged and honoured, but by no means am I magical. And really, I felt like the essence of the magic was outside the room. We would finish talking, and I'd go outside the room and be bombarded by questions. Sometimes the teachers would be waiting right outside the door, ready for me to come out. They'd ask, "Sarah, how is that student? I've been so worried about them." A parent would call, "Oh, hi, I understand that you've just met with my daughter. How is she? She has so much going on in her life at the moment. What did she share with you?" Principal would come and find me. "Sarah, in your professional opinion, what do we need to have in place to support this student at the moment?" Well, I've been deeply moved and affected by what this student has shared with me. But what of the bounds of confidentiality that in fact prohibit me from sharing what has been between myself and the student? I'm not able to answer the teacher, parent, or principal's questions in a meaningful way. It is the student's experience to share. And without the voice of the student, a great deal of talk now happens about them. Worried and concerned talk trying to make sense of something that is outside the realms of understanding for us as adults. Hypothesizing talk. Do you know that we are trained to identify things in young people as maybe indicators of something totally different. She hasn't been coming to school. She must be depressed. Oh, he hasn't been handing in his work. He must be anxious. With all the care and concern in the world, I felt like myself and the system were causing more harm than good. For without the student's voice, decisions would be made about them without them. The voice of the child, parent and teacher, so far from one another, they would become conflicted and further distanced. I wondered, could there be another way? Come with me to Finland for a moment. Not for their bird life, forests, northern lights, or current happiness quota. No, for something much more beautiful. For their ability to change an entrenched system that no longer cared for those it sought to support. A group of Finns in Western Lapland, in a mental health team, began meeting with their patients in a different way. Rather than individually, they started inviting more people into the room. This approach is called open dialogue. Open dialogue is about dialogical meetings with people's social networks. Dialogical meetings are about caring for the process of our talk as much as the content. It is about letting go of trying to fix or find a solution, letting go of using a strategy or a technique, but instead recognising that change is something that happens between us as much as within us. Dialogic meetings seek polyphony rather than consensus in the talk. Polyphony is a musical term and highlights how different sounds are able to harmonise, recognising the innate variance in our lived experience and giving space for that to be shared. Social networks are the people that we create meaning with in our lives. Create meaning with at breakfast, in the car, on the way to work, at the end of the day. My dad, my partner, my children, my community, and my social network. The people who help me create meaning in my life. Separate meetings in separate rooms with separate people ceased. This was a profound shift from the system in Finland at the time and Australia today. So come home with me now. As a group of us in Sydney, were given the opportunity to study this way of working. With Finnish trainers, we considered the adaptation of open dialogue to the mental health systems here in Australia. Now, I had this voice inside of me, and this voice didn't need me to pause or go slow. It was loud, and it was asking, how can this come earlier in a person's life? How can this way of working come when we're trying to find our voice, when it feels messy, before mental health intervention is necessary? So, in a school, for the first time, we brought more chairs into the room, not one at a time, but all at the same time. This school was willing to take a risk, to reconsider the way things were done. People in this school already valued the importance of relationships and the humanness in education. I'd ask a student, hey, can we bring that teacher with all the questions and that parent that keeps on calling into the room with us? Students were cautious and yet curious and said, yes. And when we brought more people into the room, we had to speak carefully. We had to speak slowly. We had to say less. The 8-year-old in me swoons at the gentle tenderness in this. The 16-year-old is comforted by such an opportunity. And this has been the experience of our students. We trained all of our staff in open dialogue. We have been conducting some research, and people have shared that they overwhelmingly prefer this way of meeting. Parents have spoken about understanding their children better, about having a greater relationship with their teachers, and that this presents a unique way of being able to talk in a school together. Teachers, they've shared that they're able to come to these meetings as a person and not give an institutional response, that they're impacted by the talk that happens, and it changes the way that they then communicate in classroom. Teachers have spoken about how amazing it is what you will hear if you listen first. We meet in social networks at our school for anything and everything to do with a child. We start with a question to the student, what's important to talk about today? And then respond. We speak in a way that is developmentally appropriate to the child. We have 5-year-olds join us and 18-year-olds. Some say a lot and some a lot less. This way of working, open dialogue, it supports the well-being of the child and the well-being of all of us. This is magic, after all. Thank you.